Welcome to Thought Crimes. On Thought Crimes, we discuss how our behavior affects our lives and how our lives affect behavior. On the show, we cover burnout, personality, sleep, neuroticism, and more. Today, I'm really excited to have Dr. Ravi Komatireddy on the podcast. He's the founder and CEO of Daytona Health, an internal medicine physician, and has advised and started several innovative companies disrupting traditional healthcare. So welcome. Thanks for joining, Ravi.
Oh, thank you for having me on. I appreciate it.
And also Tyler Capps, of course, is my co-host. Sometimes here, sometimes not. Welcome, Tyler, as well. Always happy that you're on.
Always a pleasure to be here.
So Dr. Ravi, can you share a little bit about yourself and how you ended up in healthcare?
Yeah, so absolutely. So I'm a internal medicine trained physician, but I'm originally from the Midwest and kind of went to school there, trained out the East Coast and the West Coast, had a strong grew up in a very strong medical atmosphere. Both my parents are physicians. All my relatives are physicians. Like if we're having a family reunion and you have a heart attack, you're in a safer spot than being in an actual hospital, I think, because we have all the specialties needed to take care of you. Probably have better outcomes than most health systems. Anyway, so the point is, grew up in that atmosphere, and it's one of those things where you grow up around like what your parents do and you go, I'm never going to do that. Right. But then you somehow gravitate toward that and you have to go explore other things, then find the way back. So you could just prove to yourself, well, it wasn't you guys that convinced me to be a doctor. I discovered that myself. And that's kind of what happened to me too. So it was the, healthcare and medicine in general is this very weird intersection of lots of different sciences, and it's an art and a science, and there's technology thrown in there as well. And being in the middle of that Venn diagram is very much fits with my personality, right? I like to go deep into some topics in some areas, but I really revel in being a part of many other disciplines. And that's what being a physician, and not just a physician, but a nurse and other things as well in the health sphere, allows you to do. And that was very appealing to me. So that's how I found myself in that sphere, that circle of medicine.
Cool. Yeah. And then also shout out, everyone on this podcast right now is UCSD alumni. So shout out to UCSD.
Awesome.
Yeah. Mixed feelings. Yeah. Go Tritons.
I've mixed topic we should explore.
Yeah. Let's do it. I've mixed feelings about UC San Diego. But I like San Diego overall. So we'll leave it there. So yeah, let's talk a little bit about what you're working on now then, which is behavior hacking. Is that right?
Yeah. So behavior hacking is a term we use internally to describe some of the things we're doing over at Daytona Health. And, we started this company because, to me, the biggest problem in all of healthcare, is not stem cells or gene editing and all that. Those are all really important things. When I look at the landscape of what people are suffering from, it's a lot of preventable disease. And when you really dive down into the things that people need to do, or the interventions or the therapies to actually, not, I would just say prevent, because some of these you can't completely prevent, but at least delay, and in some cases even reverse the diseases that we all care about, right? Like high blood pressure and diabetes and heart disease and stroke, and these things that are like ravaging our communities, right? It's choices, it's lifestyle, it's behaviors, right? It's those choices that we all make every day in sleep and exercise, and what we eat and how we kind of react to stress and how we manage our time and our relationships. These are all like things that we choose to do. I mean, in 70% of these diseases are related to this. So we live in an era which is very different than it was like 150 years ago, right? Like if you were in the Civil War, you died from an infection or childbirth or something like that. We've kind of solved that for the most part, haven't we? Like we're actually really good at those things. Like right now, these are diseases of lifestyle and abundance, right? Like this is like Uber Eats is like the problem, right? Like making this worse, right? It's kind of crazy. So the fundamental paradox here is, it's like have you guys ever heard of like the Homo economicus fallacy?
Yeah.
This idea that like, you know what I mean? Like, it's like, you know what to do. You shouldn't eat that Reese's peanut butter cup, but you do anyway. And it's like, what is going on there? So this is like the holy grail of healthcare, is how do you empower people analyze them, decode their personality motivation, get data around them, help convince, persuade, nudge to make better choices. And it doesn't seem to be a lack of education, although education's always important. But I think in 2023, we all don't need a continuous glucose monitor to know that eating a tub of ice cream is bad for you, right? Like we don't need, right? We know that, like, we are at a level of baseline education in this country. And obviously you're going to get some comments that are like, well, whole grain's good and this and keto, blah. Those are all like finer tuned conversations, right? But in general, we all know what in general is healthier than is not. And it's just so hard to do it. And that's the problem we're trying to solve. And I think that's what most people are struggling with. We started Daytona to help figure out how to solve that problem. I think we're doing a great job in medicine in a very narrow number of things, right? The heart attacks, you come into the hospital. If you get into a car accident and you walk into or get brought to an ER anywhere in the United States, there's a high chance you're going to have life-saving measures that are going to save your life. Like, you will walk out of there at some point and you'll get better. It's amazing what doctors and surgeons and the other allied health professionals and technology can do. Yet it's so hard to do the basics, like help people just get 30 minutes of exercise a day. What's going on, right? So like that is what keeps me up at night. It's like, what is going on here? Because I'm looking at these survival curves, guys, and I'm like looking at, my parents came as immigrants to this country. They came here thinking, well, our grandkids are going to live longer and have healthier lives than we will. I don't know if that's true right now, looking at the data, right? And that's scary. It's like people are getting fatter, sicker, and dying earlier. What's going on? From preventable disease. Not all preventable. There's some mental health and stuff, and people are actually getting in trouble a bit early in their lives. But that being said, we got to figure this out. So this is the biggest problem to me. How do we help people turn information, the knowledge, data, their Fitbit number, all that stuff, the technology, into real lifestyle change that sticks? That is what keeps me up at night. And I just put my foot down and said, I refuse to accept these projections. Like, I think all of us have to just wake up and go, what kind of country do we want to live in, where half of us are not just overweight, but obese by 2030? Like, no, we're not doing that. So I just put my foot down. Like, we're not doing that. I'm going to figure this out, or I'm going to die trying. Because, like, what's Elon Musk going to do? Like, have to launch a couple diabetes clinics to get us to Mars too? Like, is that what we're going to need? That's ridiculous.
Reduce the payload.
Right. Like, nobody, that movie, you ever seen the Pixar movie WALL-E? It's like we're all just in hover chairs being fed like, Walmart and Steak and Shakes. No one wants that future. Like, nobody actually wants that. Yeah. So we got to take steps and figure this out, right?
I want to jump on a couple of pieces here. One of them, this has been one of the most frustrating quotes for me because it's been really impactful in my life, but I haven't been able to find a recording of it, which is from the neuroscientist Robert Sapolsky from Stanford. He's an awesome dude, really cool body of research. And then he ended up writing a lot of like pop science stuff to like spread behavioral neurobiology and like basics of neuroscience to people. And in one of the lectures that he gave, he said, if you can figure out why people eat M&Ms when they're sad, you've got $1 billion company. And like, he was being sarcastic, but it's like a really interesting thing, right? There's two layers here. One is we're a little impatient as a culture, because like one of the thoughts I had when you were talking is like, wow, it is really amazing that we've actually solved all of these like the trauma basics, physical trauma basics. Like, you get your arm chopped off, like, right. It's at least you're gonna survive.
We can reattach an arm with high confidence. Like, that's nuts.
Mm-hmm.
Like,
it's
that's
nuts.
crazy.
It's nuts, right? That's so cool. And we're almost victims of our own success, because now, like, the one thing humans just don't want to work on, they don't want to solve, is like, oh, I feel bad. I don't want to look at that feeling. There's that thing. I'm going to die one day. That abyss that's staring at all of us. I don't want to do that. So like, okay, instead I'm going to eat or I'm going to drink or I'm going to run or I'm going to, right? I'll do anything not to actually deal with this like internal furniture. I would rather focus on the outside. I'd rather, doctors included in our society, right?
It is weird. Like, we are the only animal that is aware that I know of that is aware of their own demise, right? So there is a guillotine hanging over our heads, right? So, Rob O'Neill, the SEAL Team 6 guy who claims that he, shot bin Laden or whatever, he has this line, right, where he goes, none of us are making out of this alive, right? We're all, it's not going to work. But what's interesting that you said, though, about the M&Ms of being sad, what Robert Sapolsky's quote there. Do you know who has figured that out? M&Ms.
Oh,
right? And so when I look at the science of behavior change, motivation, drive, dopamine, all those cravings, it seems like there's a good faction of our society who actually has figured that out. Like Mars Incorporated has figured that out. Netflix has figured that out, which is why I sit there, or Apple TV, where I'm like, why I watch, the next episode of Ted Lasso, even though I know it's not going to be as good as season 1 or season 2. My point is, it seems like the behavior change science, the psychology around why we do things, has been figured out in very specific domains in a very profitable way. And those are billion-dollar companies. We binge watch things on Netflix in a way that we, 3 hours later, we get from the couch, like, what happened? Why did I watch Breaking Bad, even though I've seen it already? For like all those episodes. Or we go to Amazon and we look at the front page and like, how did they know I wanted this weird thing that I click on and add to cart with one click? So it's like the science seems to be there. Can we just repurpose it for, not to be too philosophical on this, but for good versus evil, right? For instead of buying things that we don't need or watching things that are distracting us from our goals, can we utilize it in a way that empowers us to be better versions of ourselves? So in some sense, it's like, this is not my line. Several people have said this, but everyone's looking to be great innovators in healthcare. And in some sense, it's like, stop trying to innovate. Just be great copiers. Like, copy what's happened in other areas. And if we can just bring those principles in, we may have something that's game changing.
Yeah, I have possibly a fun exercise for people to like get on board with, is like going back to the M&M thing and then connecting that with your behavioral hacking. Maybe we could use me as a case study. So Peter knows I recently have a newborn, 4 months old. And so no sleep, stress is much higher. And the way I've described it is I feel M&Ms or a glass of whiskey or video games at the bottom of this spiral waiting for me, almost as like it, and right. It's planted there as like a reward for stress. And I'm curious, like what your, if you've seen that with your clients, like explicitly, like they've built in almost a reward system for failure, like really is what it is, right? As like a failure to cope with the stress in a healthy way, and how you've approached that.
Yeah, absolutely they have. And I think I would include myself in this category as well. So let me back up 1 second before I answer your question. Just give like how I see the landscape. So if we use like there's several models of behavior change, and they're all kind of theory, right? But they're like I think it was George Box, the mathematician, said like all models are wrong, but some are useful. So like this could be useful, right? So this trans theoretical model or stages of change model. So I look at like the 300 million people that live in the United States. I think probably 5% of them are just not ready to change their behavior in any way. Like they don't, either lack of insight, capability, opportunity, maybe motivation. Think of like that uncle we all have that's smoking, and it's like you told him 1 million times, he's just like, dude, stop bothering me. It's actually, you're making it worse. It backfires, right? It's like those people we leave alone. Like they have to reach some threshold before they even get to the stage where like they're going to talk about it. They know it's bad for them. Like everyone knows it's bad, but they're like, I'm not ready to change right now. Then there's this other 5%. Now this other 5% fascinates me. They're at the top end. They're like the Peter Attias, the Andrew Hubermans. They've already got the mindset. They're like, I'm in a mindset of growth, self-improvement. Just give me the tactics. How do I get do I need to, if you told Peter Attia, or Huberman, your cold plunge needs to be 2 degrees colder to improve your life expectancy by like 0.01%, he'd just go do that, right? He's like, okay, I'll go do that. And it's like, this 5% is very interesting because they're like, we get it, dude. Just give me like exactly what to do. I will do it 110%. Athletes are like this. These people have trouble sometimes understanding what's wrong with the 90%. Now, this is like the biggest group of people. The 90% need tactics. They need to know what temperature to put that cold plunge at, but they also need the mindset to take the step to do it and to fit it into a busy schedule, to have the emotional control, to not do the hyperbolic discounting, to not to set up an alternative reward system for the ones that they know is going to be bad, to switch from type 1 thinking, which is like the, you know, like Kahneman's type 1 thinking, which is like the I'm going to grab this this whiskey and be like, hold on, I'm going to pause, take a minute, be intentional about my choice. And then at the end of that intentionality exercise for 30 seconds, if I still want the whiskey, I'll have it, but it's a choice I made, versus, wait, there's something better I can have, which is maybe just, you know, this piece of juice or whatever it is, right? Like something else. 90% of people are like that. And I'm in that 90% too. I'm not one of those just tactics athlete guys. I'm like, I need help staying on track, staying motivated. Sometimes I can't see the end goal. I can't visualize the light at the end of the tunnel. I do the hyperbolic discounting. So I think most of us are in that 90%. So we see that a lot. It's extremely common. Those people, the top 5%, right? They're like, they don't get the 90%. They're like, but we gave you the Fitbit. We gave you the data. What's the problem? Just do it. So I see this on Twitter a lot. So there's like lots of like tweets from people who are like, dude, all you got to do to live longer. And they have like a list of like 6 things. Go outside for 30 minutes, exercise for an hour, get some sunlight, have some vitamin D, you know, spend some time with loved ones. Like, wow, thanks. You know, I didn't know all that before, right? It's like, if it was that easy, we'd all be healthy. So clearly we're missing, that 5%'s missing part of the picture here.
Yeah.
And that's what everyone else. Yeah.
I was gonna say, Peter and I talk about that all the time, is that like people, like we call these guys gurus for lack of a better term, is like they're essentially giving advice to themselves or people exactly with like the same behavior profile as them. So it'll work for the 5% that are already up there. Like they'll keep, it's like they have a strong feedback loop of helping themselves. But like the feedback needs to be tailored to like there's 2% chunks here and then 3.5% chunks within that 90% of how they need to approach getting their shoes on to go for the run. Like the baby steps to even get the behavior beginning.
They need to reframe where they are in life and what, like for example, for doing that run, which maybe they haven't done before, it's going to hurt. You're going to look dumb, and it's okay. They need that kind of reassurance. Where that upper echelon 5% long. If I could modify your guru thing, like I usually call them like the longevity gurus, right? They're always like the David Sinclairs of the world. You know, just give me the tactics, give me the list of to-dos, and I'll do them. Most people just aren't like that. That's that home economics fallacy, right? They're not robots. People are rational, and they have the capacity to be rational, but like they have barriers in their thought process that prevent them from doing these things. Sometimes they're thought process barriers, sometimes just logistics barriers, right? Like if you're a 40-year-old woman who's like a partner at a law firm, who's got 3 kids at home, you got to take care of the house, the husband, the kids, work. It's like, you're just like, I don't have time in the day to do this. I know that I should exercise. I know I should go outside for 30 minutes. Yeah, no shit, I should do these. They get that. I hope I can swear on your podcast. But anyway, so yeah, I agree. It's like, so we got to really, I'm not worried about that 5%. I actually respect them a lot. I think they're pushing the edge of science. I think they're creating great knowledge for the rest of us. And I think we can, you know, they're doing a great job. They're great role models in a lot of ways. I'm worried about the 90. Yeah, I'm worried about the 90%. That's what worries me. You know, that's what keeps me up at night. It's like, how do I get those people? You know, where I grew up in Missouri, like I'm like us Missourians are like Walmart people. Like we just grew up around Walmarts and Sam. It's just like our culture, right? It's like, you know, you go back to the Midwest. I live in California now, but you go back to the Midwest, and it's like the obesity rates are insane, right? And it's like they're not bad people. They know they need to eat less and move more. How do we motivate them to get there? That's and they want to be healthy as well. They just need a support system to do that. They need a personalized approach that can reveal 3 things. Their whys. Like, I think we got to move health from cholesterol numbers and blood pressure numbers and weight numbers on the scale to more like, let's say you did lose that 30 pounds. How has your life changed? What does it do for you? What does health mean to you? And like get to those fundamental underlying motivations. Second is like, where's your physiology now? Like, what do you do now? Like, what's your baseline? Like, what are you capable of? What do we need to fix? And then kind of third is like, what kind of behavior change techniques do we need to apply to you? Those kind of fall into several categories. You got to do something with the environment. You got to do something with social support. You got to do something with, kind of intention, like helping them be more intentional and resilient. And then you also do habits. I think our society kind of overblows habits a lot. I do believe this. I think there's a Duke paper that talked about like habits being about 40% or so of our behavior. So habits are not the end all be all of how people choose to do things. So instead of like this one superfood, this one technique, this one thing, when our team at Daytona reverse engineers people who are able to take weight off and keep it off and stay healthy for a long time, it turns out they're doing like all of these little things, right? That's not like one thing. I don't know if you guys have seen this as well, but it's like they're investing in like 11 or 12 different strategies that they use in a routine, systematic way. They have social support. They've got coaching. They've got, instruction. They're always kind of training their mindset. They're leveling up their behaviors. They're using different behavior change techniques. They're changing their environment, and that's what we try to teach people.
So I want to add on this, which is I I lived in Tennessee for 1 year when I was really, really young. But it's weird how much I remember. I was like, I think 3 or 4, but it's weird how much I remember because having grown up in California and then like lived and went to school in California, most of my life is spent in California. The difference between Tennessee and California in terms of people's sentiment around things like food and their relationship with them or exercise, right? Is like greater than the difference in between California and Mexico, for example, like in really? Attitude, right? I mean, specifically,
what way? I'm so curious. Like,
so people in Tennessee, like the obesity rate is through the roof, and this is like anecdotal and from a long time ago, but they would do things like if you go to someone's house, like kids would get served a liter of Coke and a tub of cookies, and it's just like, well, that's what you do. It's a sweet child.
It's hospitable. Eat, right? It's like you're being a nice person doing that,
and,
right?
Yeah, right. And so things like that. And then you're talking about the Midwest. I have family in Indiana. When we visited, my aunt Katie, she offered me a snickerdoodle, and that's what I thought a snickerdoodle is, like a cinnamon cookie. No, it was a tray with chocolate chip cookie at the bottom, a layer of 40 Snickers bars melted on top, and then she cut me the slice of like a cake. Right. So it's like
the Snickers the size of a Labradoodle.
Right, pretty much. Yeah. So that's one thing, is just that it's like I think the problem, to comment on what you're saying, the problem of like reducing these ideas down to like, it's actually a procedure of things that you must do. It's like, just get through this list. It's like, yeah, technically you're correct, but you're discounting the fact that when I go to my uncle's house or something, they're going to give me a liter of Coke, and I freaking love Coke. I mean, it's not like I don't like Coke all of a sudden, right? So there's this dishonesty in here of like, right. It's like make yourself not like it, right? This is like the like, just tase yourself every time you have Coke. And right. And it's like, well, okay, that's yeah.
It wasn't zoo. What was that? It was dodgeball, right? Where he's got like electrocuting himself, looking at pizza.
Yes. That's the second time that scene specifically has come up on this podcast, which is funny, which gets into my second point, which is that people have the wrong idea. And I honestly think it all comes down to, honestly, like the idea of Pavlov, right? Like this Pavlovian version of behavior of like, we're just dogs and you get a treat for doing good stuff. And what Tyler and I were talking about off the podcast is dopamine response is completely misunderstood. It's not a reward for the outcome of an activity. It is the reward for the pursuit of the activity, which, like, that's
right, the craving.
Exactly, which is like why then what Tyler said earlier makes so much sense. You're like, I feel bad. Like M&Ms, like it's actually, you might get more dopamine from the thought of the M&Ms than the actual M&Ms, which is like, that kind of shatters, I think, the common, mainstream model of, whoa, this is what's going on in my brain. And then to your point earlier, it's like companies It's like great. How many chips can we stack against us? Know this. TikTok knows this. YouTube knows this. That and
Right.
they're not evil. They're just pursuing the profit motive. And it's like, hey, if we push this button more, we make more money, and that's our job. And if we don't do it, by the way,
Right.
I'm a CEO and I don't do that, I can get not just fired, I can get sued by my investors. And the investors are like, I don't care what you do. Like, your job is I give you money, you make me more money. So like it gets super this little seed like butterfly effects up into like, oh no, what's the problem? Is it then you can get all in your head. But if you just like
Yeah.
settle and you're like at the individual level, can behavior change? Yes. Can anybody change? Yes. And like I think what your theme is and what's in a lot of what you guys have produced is the idea. It's like, well, you need to understand motivation, you understand the whole picture, you need to understand the person. I think it's really cool.
Yeah. Yeah. Everyone's whys are just different, and everyone's sensitive to a different charcuterie board, if you will, of behavior change techniques. We have a member, for example, at Daytona who just does not like competition. It turns her off. It's not something that she feels good about. Whereas, you can imagine a lot of other people that we probably know really thrive on that, right? So that, she likes collaborative efforts, social ways of exercising, kind of commiserating amongst peers that kind of understand each other. That's more motivating for her. And other people who on paper may have the same job, same income, same upbringing, are just different psychologically. I mean, then they're much more competitive. If we don't, as a healthcare system, take the time to understand those differences, I don't think we're going to make a lot of progress here. Because giving both those people who are sensitive to two different opposite things but are very similar the same to-do lists, you can't reach them that way. And I think it's like you said about the exploitation here by companies on the behavior science and behavioral economics. It's a great book. It's an older book now. It's definitely worth the read. It's by Eric Schlosser, who wrote this book called Fast Food Nation, and just talks about the odds are stacked against us in some sense. He talks about the number of PhDs employed at McDonald's to just make sure that the fries, when you put them in your mouth, like make your nucleus accumbens, like your pleasure center in your brain, explode on MRI, right? Like it's just designed to do that. Now, fighting that is an uphill battle. So we have to go around that a little bit and be like, okay, well, let's just not drive past the McDonald's. Just not even get the cue in your brain. We've literally given people, as part of our kind of coaching, different ways to get home using Google Maps that bypass them around those cues of fast food joints on their way home. Because when you're 5 p.m., you've had Zoom calls all day, you're busy, you're tired, you've got stuff you got to do when you get home, your impulsivity level is higher. You're going to like succumb to one of those things. We got to nip it in the bud. So there are ways around this. And what we tell people is you don't have to be perfect. You just have to make more good decisions than bad, and you'll start seeing results. Not everybody needs to have a BMI of 21 with a six-pack. That's not, I think, a realistic goal. It's a realistic goal to be a better version, a healthier version of yourself, where you're thinking about food, exercise, your lifestyle, and health in a healthier way, rather than being reactive to it. I think that's all what we want, right? We all want health span. We want to live longer. The longevity gurus are right. We do want to live longer, but you just don't want to live longer disabled. You want to live longer being functional, being able to go after things you want. And a large part of that is movement and eating right. But really the thing we're trying to protect is cognition. What we're trying to do is protect brain health. Everybody wants to be smart, on top of it, sharp, not tired, fatigued, not foggy, and do well at work and at home. And these behavior change things we're working on, what we're really doing is protecting. You're making an investment to keep a healthy brain. And that's what healthy aging really is: being able to move, having flexibility, having some financial stability, and having an intact mind. So that's what we're aiming for here.
To drive that point home as just an example for the listeners, would you be able to provide an example of like two diametrically opposed people in terms of their behavior and how you and your team have brought them to physical health?
Yeah. So I think speaking of these two members, I was thinking about it. I think I mentioned one that didn't like competition.
Mhm.
You know, we've had to, so her baseline in another female member of ours had a very similar baseline in terms of where they were physiologically, in terms of insulin resistance, overall kind of fat mass, blood pressure, all those things. And the nudges we've had to send to one of those members who was very much in the collaborative model of behavior change, and he used techniques that were very different the ones we had to send to the other. Not only were they different, we actually had to change the way we approached the coaching in general. Let me tell you what I mean. In some people, I would say actually you two would probably relate to this. You seem like you're very busy, you know, you're running a company, doing a lot of things. It's like if I came in to coach you and I gave you a bunch of to-do list items, you'd be like, how am I going to add this on to my already busy schedule? Like you're just giving me more work to do, right? We've actually had to come in with what we call a decompression period. So when you sign on to us, it's very interesting. We actually apply what we call a health valet first. Think of it just like a fancy executive assistant. So all of our members get an executive assistant as part of this process. And what they do is give me your calendar and let me just start taking things off your calendar. And this kind of surprises the members, like, what? And we're like, no, this is the part of it because I'm not going to give you more to-do lists. There's only 24 hours in a day. Let me take things off. And that really helps. The second part of the decompression is actually talking not to health coaching, but life coaching. So these people are very good, extremely skilled at helping people prioritize time, themselves, reframing, like kind of almost giving people permission to take care of themselves versus taking care of the other responsibilities that are external. And that's what a lot of people need in the beginning. We learned this the hard way, right? Because we learned that this is what you need to do for very busy people. Some people, however, like one of the individuals I mentioned, they just want to go right off the bat. They're like, where's the personal trainer? I'm ready. Let's go. I don't need decompression. I want compression. I want more stuff to do. I want to feel like I'm making progress. And so all of these people at the 6 month or 7 month time point will see significant improvements in weight loss, metabolic health, fitness. But if you don't approach that, you don't give the decompression to the people who need it first, they just can't latch on.
Mhm.
You're just giving them more things to do, and that really kind of annoys them, right? They're like, dude, I know I got to run. I knew that before I hired you. Like, what? Help me out. Like, help me find the time. Where other people are like, I want to see progress now. I want to see my resting heart rate go down in like 3 weeks. So it's just understanding those differences. And we've done this so far, and it really makes a difference.
And I think that you guys taking stuff off of their calendars as the starting point is genius. And like an example of this is I recently had like a shoulder and knee problem at the same time, and I saw a physical trainer about like what to do to fix that. And they gave me like all these lists of stretches and exercises, and I just did a simple math exercise in front of them, and I was like, this adds up to 2 hours every day.
Yeah.
Of just stretching. And like when they were giving anecdotes before I did the math, they're like, oh yeah, I usually just do some stretches in the shower and here and there. And I was like, that's physically impossible. So it's right. It's one, helping folks get stuff off their calendar to make room for it, but also right sizing it for their life constraints. That's great.
And we know that long term, I wonder how you guys deal with this. When someone says, I don't have time to work out, you know that like part of our brains is empathetic toward that person. We get it.
Mm-hmm.
But you know that is the doctor in me and the behavior change, CEO in me is like, I know that you think you don't have time, and I'm going to show you in a year's, in months of coaching that you'll be able to fit this in, and you'll actually have more time because you'll be more productive. We all know that that's true, but when you're when you're first starting out, it's really hard for you to see that, right? It's really hard for you to see that. You're like, I'm on Zoom calls all day. How are you going to, do you have access to a black hole or something where you're going to time dilate my day in a way that I'm not aware of? Like you said, that's a $1 trillion company. Right? It's like, no, we don't have that. So like, how are you going to do it? But when you look at Fortune 100 CEOs, one of the things that's been looked at is like, they get asked like, well, do you work out? They're like, yeah, they all do. They all work. So it's like, how are they able to do it? Right. And if you're a senior VP at a company in marketing and you're handling all this stuff and you got a full day and whatever, How come you can't, right? It's like they just need the support system. So we know the long-term solution is helping them reframe their time, their perception of time, their perception of what's worth it to them. But in the beginning, we need to kickstart that a little, and that's why we use the health valet. So it's like easier just to go, you got a date night with your husband, let us take care of that. You're trying to find a nanny, let us take care of that. We'll book the dentist appointments for you. When we first started this, by the way, like this scared the crap out of the team. Because like, wait, Ravi, like what? But isn't that a whole business like itself? Like executive assistants? I'm like, yep. But I'm like, it's worth it. And it has to do with health. And this is the stuff that we do, a lot of this stuff that just is health related, but you just never think it's health related, but when you are actually getting people to do things to change their lifestyle, this is the stuff you have to do. And this is stuff you'd never get taught in med school, like, oh, this is how you do, you help people plan parties so that they can take that off their plate. So they have the time to go eat right and do food planning. They don't teach me that, right? They don't teach us that, right? But like, this is that social determinants of health, a term everyone talks about, but when you actually get down to it, you got to address these things.
It's such a good point. Social determinants of health ends up getting thrown around in academics, and it's like going back to, you show up at your uncle's house. You talked about the smoking uncle. I have a literal I mean, it's like so funny. His name is Ray. I don't call him Ray, but I got Uncle Ray, right? And he like will never ever change his diet. He doesn't want to. He's fine with it. He's fine with paying the cost of it. And so for someone like him, if you're gonna be like, yeah, I'm gonna get you down to a BMI of 22, it's like, no. We're that's not the fight we're fighting here, right? Like we, and in fact, we don't want to fight a fight. You wanna like increase the number of times in a week that he's had a piece of broccoli or something like that, like or whatever, right? And not for you to feel good about helping him. It's like, hey, did this make you feel better? One of the big, you asked like how we've approached this in a pilot program we've run. So yeah, we don't work directly with people currently, but in a pilot program that we ran testing out our software, the coolest breakthrough for me was hearing from people the revelations, because we start with personality traits. We have a really deep dive assessment, which I won't get into here, but when people realized that the thing they were doing that was working, that they felt guilty and indulgent about, like they had some hack, we're like, do more of that, right? Someone told me, it's weird. I go to the gym and I feel like I'm not doing it right because I don't want to socialize. I want to have a chill gym session and I'm okay with being there for longer. I don't get it done in 30 minutes. I spend like an hour and a half there, just kind of hang out at the gym. But since I started doing that, my fitness has improved. I'm like, all right. Like that is now we have step one. We have a thing that's working. Then you can optimize. And I think the problem is people hear about, okay, the right way to go to the gym is to do high intensity interval training and like to get it done and knock it out. And then to like run out of the gym and go get your protein shake and then go make $1 million, right? Whatever. Mm-hmm. And like you, I'm in that 90% of people who don't have super high discipline. And for me, one of the hacks I used to get a habit of going to the gym was including the post-gym, like sitting in the sauna and like taking a shower and like meditating for a couple of minutes as part of the workout. So I was like, well, yeah, my workout is maybe half an hour of lifting heavy weights, but I have a whole 20-minute like spa session coming up after this. That was what was necessary as my solution to like actually maintaining a regimented workout routine.
So isn't it interesting? Like the thing you changed was just the way you framed it. And that's like a thought process change, right? And
totally.
like we don't talk about this enough in what I would say the traditional medical model. We like to look at number, but we like to pride ourselves on data. Well, that's all wishy-washy stuff, Ravi. Come on, like what's the actual cholesterol doing and what's that? And it's like what we're not understanding here. And this is why I think the traditional medical model is not really good at this, right? We're good at putting back the reattaching your arm after trauma. We're not good at this part because we need to understand this wishy-washy stuff is the actual stuff that makes people tick, right? It's not as measurable in some sense, but it's just as important. It's this, and like you were mentioning, you use batteries of testing to measure it, and so do we. One thing we have noticed when we do employ these tests, and I think the big five personality test is probably the most validated of tests, right? So like as Jordan Peterson says, like every validated test in psychology is some version of the big five. It's probably true.
Mhm.
One thing we've noticed is this idea of are you coachable? And I'd be curious to see what you guys think about this. But one pattern we've seen is the openness part of it. So like, how open are you? And sometimes people just aren't open. It's like, and those people I worry about, I'm like, well, is this the right fit for you? Is this something you want to change? Or are you willing to think differently about something that you've thought before? Right? It's almost like becoming a member of Daytona Health is almost like boarding a plane where like we're coming to this plane as coaches with baggage, they're coming as patients with baggage, and we just can't fit all these bags. So we got to like let some of these bags go. Which ones are you going to let go? Like our preconceptions about you, sure, we'll change our preconceptions based on data and when we get to know you. But are you willing to change the way you think about food or to change the way you think about exercise? Because if you're not willing to, I worry that it's not going to stick or you're going to get the outcome you want. So that's hard, right? You're changing people's worldviews. And these worldviews have been shaped by family, friends, movies, TV, advertisements, big pharma, the system.
Mhm.
Yeah.
It takes time to reverse some of these things. Diabetes is not an overnight, like people don't just wake up with diabetes. Like, oh yeah, I was good for 20 years and I got diabetes now. Man, bad luck. It's like, no, you had the beginnings of diabetes for the last 10 years, right? It's a process. So if we're going to reverse type 2 diabetes now, or really make it better, at least, it's going to take some time, patience, practice, probably some failures. And, our members kind of don't go in this linear, like, hockey stick curve, right? They have their good days, bad days, good weeks, bad weeks, this net positive over the course of months. There's no hacks. You can't shortcut it. There's no superfood that you're going to eat that's going to make it better. Those are all great things at the tip of the pyramid. Like once you've mastered the basics, and that's kind of our model: incremental, small changes over time.
Mhm.
The consistency will yield the result you want.
Yeah, I couldn't agree more. And I'm trying to prevent myself from going down too deep of a rabbit hole because I think we're approaching the end of our time here. Just quick check, Peter.
Yeah, I was just leaving some space so you could add some comments, but yeah,
Yeah.
we're wrapping up. The last question I have actually for you is, are there things that you're really excited about? It's a two-part question. One is, are there things that you're seeing, coming from technology that are going to intersect with healthcare that you're excited about? And then the other one is essentially, if people want to get involved or they want to reach out to you, or maybe they're curious about Daytona Health, where they can find out more about it. So those are the two questions we can end on.
Yeah, absolutely. So to find me, www.daytona.health, book a discovery call, talk to me directly, email me directly. Happy to get on a call with people and just see if they're a good fit or want to learn more. That's easy. And find me on Twitter or LinkedIn or whatever, and you can DM me, and I'm happy to, I check all that stuff. So, I'm in the people business. So I love talking to people. The second thing is I'm super excited. We're living in an amazing time. Turn off, turn off the news feed and all the negative stuff. The truth is, I've never been more optimistic about being able to solve this problem for people. Things are converging at the same time. One, people are waking up, especially after COVID, where they've like gained the weight. They understand the need for other people's support systems. You don't miss the gym until you can't go to the gym, right? And you're like, oh my gosh, this sucks, right? So it's like people get it. They're smart. I fundamentally believe in the potential of people, and they're waking up and they're sick and tired of being sick and tired. They're sick and tired of a healthcare system that is not serving them in the way to be preventative, and to treat the root cause of things and to focus on their behavior and do it in a personalized way. So they're yearning for something different. We've got a whole ecosystem of the doctors in the healthcare system now. I'm actually seeing them change as well. I'm seeing them be much more open to technology and to lifestyle change, not just pushing pharma and drugs. I'm seeing that happen. Just the ones on social media, the ones talking now. I mean, I'm seeing that. I'm really excited about that. I think because they're also patients. All doctors are patients, right? Like they're also wanting to live a long life and do these things. Third, the science is there. We have incredible science backing up the claims about the impact of lifestyle and its impact on cardiometabolic disease. We know that these are solid recommendations, and those guidelines are reflected in all the major professional organizations. And fourth, we have the ecosystem of technology that's helping us do that in a way that's portable, timely, effective, and cheap, right? I mean, if you told me 10 years ago you'd be able to buy a blood pressure cuff from the Apple store, I'd be laughing at you, right? But you can do that now. So this technology is getting available. It's cheap. It's like these sensors, the Apple Watch Ultra, the Fitbit, whatever. You can track the physiology that matters to you. Labs are now accessible to you. So yeah, all the pieces are there. I like to think of Daytona amongst other companies as well, but as we are part of a movement of startups and companies that are creating integrated platforms that can help kind of decipher all this information and tools and people together and make it accessible to people in an integrated way. That's exciting to me. So I'm super optimistic. I think we're going to make real progress on this, and I think we're going to be able to change the course of those survival curves. I think those are works in progress, not set in stone.
Nice.
I love that. And just a note of optimism for everyone listening is like Dr. Ravi just said, there's so much out there for you to use. There's all the tools you could almost imagine exist. People willing to help. We just got to help you find what works for you. That's it. It's
Absolutely.
nothing's impossible. You can get there.
Totally
Excellent.
doable.
Yeah. Well, we'll end on that really optimistic note. Thank you so much, Dr. Ravi, and thanks, Tyler, as well. And listener, thanks for listening. This has been Thought Crimes, and I hope you have a great day. All right. See you later.